Hi, I'm Moira D'Arcy. I'm a chartered physiotherapist and I work at St Judes Clinic in Leighton Buzzard. This week is National Back Care Week and it's a charity event week aimed at people being more aware of back pain, neck pain and how to prevent problems associated with that. 4 out of 5 people will suffer from back pain at some point in their lives, so it affects an awful lot of us, and so it's very important that we know a little bit about how to protect ourselves from back pain. Many of the problems start off as postural causes. We spend a lot of time sitting at desks these days, driving cars, much more sedentary work involving repetitive movements, which can cause stresses and strains to ligaments, muscles, discs in the back. For example, here is your low back area. These are the discs. Through these small holes, the nerves come out and travel down the back of the leg to form the sciatic nerve. You've got small joints then either side of the spine that act with the discs to allow movement to occur. And the discs, if they're loaded repetitively, such as when we sit for hours and hours, do repetitive forward bending movements, again for example, will cause increased pressure in the discs and stresses and strains will build up over time. And that can then cause impingement, pinching pain onto the nerves, which will then give you sciatica, for example, in the neck area. This can similarly create arm pain where the nerves are pinched in the lower neck or the upper neck. Quite commonly we see people coming into a forward position with their neck, and that causes this compressive effect at the low neck and the upper neck. Obviously the muscles, the support system is very important, and with physiotherapy not only do we try to actually get the person out of the positions that are repetitively causing the problems, but we teach them exercises to keep their necks mobile, but also strengthen supportive muscles, and what we call the stability muscles. Apart from long periods of sitting, either driving or at your desks, repetitive lifting movements can be a problem, and even how we sleep. It's very important to check your mattress out, for example, because if you're lying on too hard or too soft a mattress, that can actually, again, cause these postural stresses and strains to ligaments and muscles and discs and create problems for us. Neck position as well is very important. There are neck pillows on the market, for example, that help support the neck, but it's each to their own really on that one, and again, it's looking at the individual and deciding on what their needs might be.
What have you been doing for Back Care Week then?
This year we're actually running an advice line, and people can ring in and talk about what's bothering them, and we can give advice on maybe how to alleviate problems or prevent problems. We've been running something for Back Care Week now for the last 20 years. The clinic's been open that long, and that's ranged from talks to GPs and to lay groups as well, just to get the advice out there and the awareness of how to protect